Hi, my name is Holly Callas-Sullivan. I am currently a graduate student at Morningside College, and I am a kindergarten through sixth grade special education teacher. The title of my research is The Effect of Mindfulness Instruction on Elementary Students with an Emotional or Behavioral Disability. The problem that I was looking to solve is through mandates of No Child Left Behind and Common Core, we are placing more and more expectations and higher expectations at a younger age for students. The identification for my students as participants in this was they had to have an IEP and either be formally identified as having an emotional or behavioral disability. Why is this problem important is that because of these high demands that we're placing on students at younger and younger age, that it is causing more students to exhibit higher anxiety and problematic behaviors. Why I chose this problem is that this appears to be an issue that's on the rise. We seem to be seeing more students at younger and younger ages that are exhibiting problematic behaviors and behavior difficulties. Schools seem ill-equipped to best help serve and take care of and help these students learn. Another reason is that my son is actually twice exceptional, and school has consistently been a struggle for him. So I wanted to find a way that I could help both my students and my personal child in, dealing with emotional and behavioral difficulties. The literature review framework is that yoga has been around for approximately 5,000 years. However, which is a part of mindfulness. However, being used for the purpose of lowering emotional distress has only been explored in recent decades. In a Hollis and Jankowski research, they discovered that mindfulness therapy helped both mental and physical illnesses across all ages, from children to adults. Metacognition and mindfulness go hand in hand. Metacognition is the process of thinking about one's thinking, whereas mindfulness takes that a step further to determine if a thought is positive or negative. And if it's positive, then you should hold on to it. And if it's negative, that you just need to let it go and not be affected by it. Mallow and Austin in 2016 examined a possible link between increased demands and students suffering from anxiety. They noticed an increase in scores as a positive trend that through the use of mindfulness, students could actually lower their anxiety and problematic behaviors. Another research, the Disciplinary Alternative Education Program, or DAPE, there were improvement in all areas measured by the Student Youth Outcomes Survey. In another study conducted by Accardo, they used the use of yoga and mindfulness as a school-wide PBIS program, so all students K through 12 received instruction on mindfulness, and they had a 100% effect size. Some considerations are that certain types of mindfulness may be intended more for students that are at risk, not significantly at risk, meaning that they would not have an IEP, but they were considered at risk of developing anxiety or behavioral problems. Another consideration is the use of Yoga Nidra, which also showed positive outcomes, is that there would be prerequisite skills of several weeks of yoga instruction prior to being able to do Yoga Nidra. Another consideration is that Inner Explorer does in fact have a cost after the free 30-day trial. The gap in research that this study looks to fill is that previous research has focused on residential facilities or alternative schools. Even though they've shown predominantly positive effects, that does not necessarily determine whether it would be helpful in a public school setting or not. This research seeks to fill that gap. The purpose of this study is to determine the effects of mindfulness instruction on 1st through 6th grade students identified as having an emotional or behavioral disability. The hypothesis is that elementary students who have a behavioral or emotional disability and receive mindfulness instruction will increase their abilities to self-regulate their minds and bodies and decrease problematic behaviors. Overall information. The tool used for this study was a computer and the Inner Explorer program. The measurement device was Strengths and Difficulties questionnaire. The variables. The independent variable is the presence or absence of relaxation technique instruction from a special education teacher. The dependent variable is the student's attitude as measured by the Strengths and Difficulties questionnaire, as well as each student's daily behavior sheet. I chose an ABAB design. The possible impact: the results of this study could be helpful to special education teachers when determining instructional decisions about mindfulness and behavior instruction. This could also help get a target area that would help narrow down instruction for the vast area that can be covered with emotional and behavioral disabilities. My work as a practitioner will be impacted by whether or not I continue to use Inner Explorer as a mindfulness intervention and how I select interventions in the future. The demographics of participants. This study took place in a small Midwestern town. 56% of the participants received free or reduced lunch. There were 10 students total in the study, with only 4 of them meeting the targeted criteria. 6 males and 4 females in the entire group, and 3 males and 1 female in the targeted group. All students have an IEP. There were not any ELL students in the group. Ages ranged from 6 to 12 with an average of 9. The entire group consisted of 90% Caucasian, 10% African American, while the target group was 75% Caucasian and 25% African American. Materials included the use of a computer, access to the Inner Explorer lessons online, and the Strengths and Difficulties questionnaire. Methods. There were 3 phases over a total of 9 weeks. 1 lesson was conducted each day. The lessons ranged in time from 5 to 15 minutes, and they worked upon one another, so they were done in succession. The baseline phase lasted 2 weeks, the intervention phase lasted 6 weeks, and the post-intervention phase was conducted 1 week after the intervention ended. The data analysis was composed of paired sample t-tests from the Strengths and Difficulties questionnaire. The Strengths and Difficulties questionnaire has a reliability coefficient of alpha.0.73 and has adequate criterion validity. Daily behavior sheets were collected and analyzed daily, as well as every 2 weeks and at the conclusion of the study. Again, the purpose of this study was to test effects of mindfulness instruction. The results showed no significant increase in scores on the Strengths and Difficulties questionnaire. Baseline to intervention phase, as well as intervention to post-intervention phase, showed a small effect size and no statistical significance. As you can see in the table, baseline to intervention, treatment to post-intervention, and baseline to post-intervention all showed a small effect size and no statistical significance. In all, findings did not support the hypothesis that teaching mindfulness was more effective than not teaching mindfulness. However, a decrease in problem behaviors and increased self-regulation was noticed by observations and examining each student's daily behavior chart. As you can see on the mean scores, the baseline mean score was 26.82, intervention mean score was 24.91, and the end mean score was 23.73. It's important to note that on the Strengths and Difficulties questionnaire, some questions are reverse scored. So on some items students would want to score higher, on others you would want them to score lower. Connections to past research and theory. Research supports the use of mindfulness instruction in alternative school settings, but little statistical evidence is available for typical elementary school settings. Students with an emotional or behavioral disability are more likely to make choices based on impulsiveness instead of sound decision-making. They make these choices without first considering options or consequences. This can result in negative emotional or behavioral effects. This current study supports other current results on using mindfulness to decrease problematic behavior. Through the DAPE, they used metaphors, role play, and drawing, and the results of this study align with that because the majority of students made growth in appropriately expressing their emotions and feelings. The study also aligns with the CARDO as a Tier 1 intervention because students showed a lower level of stress and lessened anxiety. The study also aligned with the Rothier, Martin, Roberts, and Blanche study on meditation and mindfulness and helping students from low SES overcome negative thoughts and have a positive impact on relationships. The implications for teachers are that research shows this is the current best practice. This also empowers districts to adjust instruction to best meet students' needs. There are also additional students who benefit, including those that are not formally identified as having a behavioral or emotional disability. And it helps build rapport and relationships, which is something that is imperative with all students, especially those whom are already struggling with an emotional or behavioral disability. Implications for student is it is advantageous for students to have the ability to think about one's thinking and appropriately process negative and positive thoughts. It's also advantageous to have online instruction as it's more engaging. The teacher can observe and participate and gauge stress levels of students. The curriculum is still taught in the special education setting, but could also be taught in the gen ed setting. Mindfulness is presented in a meaningful context and goes right along with the behavior intervention that they're using for specially designed instruction. There is also an increase in positive interactions with the teachers about things that might not otherwise come up or be addressed. It can maintain a smaller teacher-to-student ratio, and it helps the student increase their ability to make sound decisions based on good decision-making, not just on impulsiveness, which can help the student fit in socially, as well as lessen the stigma towards their disability. Limitations. The small sample size. There were only 10 students in all, with only 4 participants meeting the criteria. Only 3 out of the 6 grades had students that met criteria. There was also the limitation of the duration of study. Mindfulness takes time to be successful. There were time constraints for each of the baseline intervention and post-intervention phases, and the rate of acquisition may not be consistent throughout the school year, so it would be important to do a longitudinal study on this. Another limitation is that target students may exhibit problematic behavior and decreased self-regulation skills. So we know that from the beginning. Also, the Inner Explorer is that it follows the explicit instruction model and is presented in online audio format. The focus of the intervention would continue past post-intervention phase, meaning that students may, in fact, show lessening of behaviors after the intervention had ended. Also, behavior and attitude are complex problems. It's difficult to kind of peel back the layers on that. So no one intervention will work for all. It's not a one-size-fits-all, and not one intervention can predict success overall. Also, you cannot isolate one aspect of behavior without potentially influencing the others. There's also the external influences. So depending on the parent's level of involvement, the student's desire or motivation to want to increase their self-regulation and decrease problematic behaviors, as well as their cognitive ability or level in their thinking and reasoning skills. Another limitation is there was a difficulty in developing a consistent time. So there were often schedule conflicts, or, we were tight on time of pulling out students, and the amount of lessons taught affects results. So how many lessons each student received could impact scores. Recommendations for future research. It's recommended for a replication of this study for a longer duration to continue to strengthen and challenge the students of this finding. So to find out how they would do on a longer study of that. Conducting the research on a larger group of participants that's more representative of the targeted population, maybe even using a control group, an experimental group, a different type of study. Also, examining the subtypes of disabilities. So dependent on what type of disability that student has, emotionally or behaviorally, could make a difference on what the scores were. Examining the subscales of the strengths and difficulties questionnaire could actually yield different results too. And then, does the degree of disability affect results? Conclusion: the hypothesis was not supported. Behavior charts did show positive gains. Mindfulness instruction may be an effective intervention, and additional studies are needed. Thank you.